Have you ever heard of these unusual medical diseases? Unusual medical diseases are those that are not commonly known or understood due to their rarity, unique symptoms, or the limited research available. These conditions often baffle the medical community and leave those affected feeling isolated. However, understanding these diseases is crucial to advancing our medical knowledge and improving patient care. So, buckle up for an intriguing journey through the alphabet of health anomalies. Prepare to be amazed as we dive into some of the world's most unusual medical diseases. Let's kick off our journey with the letter A. Starting with alkaptonuria, a rare genetic disorder that affects 1 in a million people worldwide. This condition prevents the body from breaking down 2 amino acids properly, leading to a buildup of a dark pigment in the body. This can cause the urine to turn black when exposed to air, and can even lead to arthritis in adulthood. Next up is Brugada syndrome. This is a potentially life-threatening heart condition, characterized by abnormal electrocardiogram patterns and an increased risk of sudden cardiac death. It's named after the Brugada brothers who discovered it in the early 90s. Moving on to the letter C, we have Capgras syndrome. This is a psychological disorder where a person believes someone they know has been replaced by an imposter. It's a fascinating condition that often occurs in patients with schizophrenia, but can also arise after brain injury. Dancing mania is our disease for the letter D. This isn't a disease you'll see today, but it was a social phenomenon that occurred in Europe between the 14th and 17th centuries. People would start dancing and couldn't stop, sometimes for days on end. It's a mystery why it happened, but it's suspected that it could have been a mass psychogenic illness. E brings us to Erdheim-Chester disease, a rare form of non-Langerhans cell histiocytosis. This disease involves an overproduction of white blood cells that can infiltrate various organs, leading to life-threatening complications. It's so rare that it's estimated to affect less than 1 in a million people worldwide. Lastly, for the letter F, we have fibrodysplasia ossificans progressiva. This is a disorder where soft tissues progressively turn into bone, restricting movement. It's an extremely rare condition, affecting approximately 1 in 2 million people. These diseases, while unusual, are very real and impact people around the globe. Moving on to the next set of letters, G through L. Let's begin with Guillain-Barré syndrome. This rare neurological disorder sees your body's immune system mistakenly attack your own nerves. Often triggered by an infectious illness, Guillain-Barré syndrome can lead to muscle weakness and even paralysis. However, with medical intervention, most people recover, although they may experience lingering effects. Next, we have hyper-IgM syndrome, a condition that prevents the immune system from effectively fighting off infections. People with this syndrome are particularly susceptible to common germs and pathogens, leading to recurrent infections that can be severe or even life-threatening. This is a rare genetic condition that typically becomes apparent in infancy or early childhood. Isaac's syndrome, also known as neuromyotonia, is a condition characterized by continuous muscle stiffness, twitching, and sometimes even excessive sweating. This unusual condition is often caused by antibodies that block nerve signals to the muscles, leading to these peculiar symptoms. Jumping to the letter J, we have jumping Frenchman of Maine. Yes, you heard that right. This is a rare disorder characterized by an unusually extreme startle response. The exact cause remains a mystery, but it was first identified in the late 19th century among French-Canadian lumberjacks in Maine. Klippel-Feil syndrome is a rare bone disorder, where 2 or more of the 7 bones in the neck, known as cervical vertebrae, are fused together. This can lead to a short neck, low hairline at the back of the head, and limited movement in the upper spine. Finally, for this section, we have lipodystrophy, a disorder that involves the loss of fat tissues, often resulting in an abnormal distribution of fat in the body. This can lead to a variety of health issues, including insulin resistance, diabetes, and high cholesterol. From neurological disorders to rare genetic conditions, it's clear that the range of diseases starting with letters G through L is as diverse as it is fascinating. It's a stark reminder of the myriad ways our bodies can malfunction, but also of the incredible advancements in medical science that allow us to understand and treat these conditions. The medical world truly is full of surprises. Now, let's explore diseases from M to R. Our journey begins with Morgellons, a mysterious condition where people report feeling like fibers are sprouting from their skin. It's a source of hot debate among medical professionals, with some claiming it's a physical illness and others suggesting it's a form of psychosis. Either way, it's undoubtedly unusual and disconcerting for those experiencing it. Next up is neuromyotonia, also known as Isaac's syndrome. This rare neuromuscular disorder causes excessive muscle activity, leading to muscle twitching, cramps, and stiffness. Imagine your body constantly on the move, even when you're trying to rest. That's the reality for those with neuromyotonia. Then we have Ondine's curse, or as it's officially known, congenital central hypoventilation syndrome. This condition is as frightening as it sounds. It affects automatic control of breathing, meaning those with the condition must consciously remember to breathe, especially while asleep. It's named after Ondine, a mythological nymph who cursed her unfaithful husband to stop breathing should he ever fall asleep. Paraneoplastic pemphigus is our next stop, a rare autoimmune blistering disorder. It's usually associated with malignancies and it affects the skin and mucous membranes, causing painful blisters and sores. It's a grim reminder of how our own bodies can sometimes turn against us. Moving on, we encounter Q fever, an infection caused by the bacteria Coxiella burnetii. It's most commonly found in cattle, sheep, and goats, and can cause severe flu-like symptoms. While not as rare as some others on this list, it's unusual in its animal origins and the fact it can survive in dust and soil for long periods. Finally, we reach Rapunzel syndrome, a rare and unusual intestinal condition caused by ingesting hair. The name comes from the fairy tale character Rapunzel, with her famously long hair. In this case, the hair forms a trichobezoar or hairball in the stomach, which can extend into the intestine. Incredible, isn't it? The variety and complexity of these diseases is astounding. Last but not least, we have diseases from S to Z. Starting with S, stiff person syndrome, a rare neurological disorder, takes the spotlight. It's characterized by stiffness and functional impairment of the muscles, often leading to postural deformities. The cause is still a mystery to medical science, but it's thought to be linked to autoimmunity. Next we have trigeminal neuralgia, or T. This condition affects the trigeminal nerve in the face, causing severe facial pain that can be triggered by everyday activities like eating or speaking. It's often described as a shooting pain, like an electric shock. Moving on to U, we encounter uncombable hair syndrome. This condition does precisely what its name suggests. It makes hair uncombable. The hair stands out from the scalp and cannot be flattened, giving it a spiky appearance. It's rare and usually improves with age. For V, we have vanishing bone disease, also known as Gorham's disease. It's a rare condition where bone matter starts to disappear and is often replaced by lymphatic vessels. The cause remains unknown and it can affect any bone in the body. Next, werewolf syndrome or hypertrichosis represents W. This condition causes excessive hair growth over the body, often giving the affected individual an appearance reminiscent of mythical werewolves. For X, we discuss xeroderma pigmentosum. This is a rare genetic disorder that makes the skin extremely sensitive to sunlight. Even a small amount of sun exposure can cause severe sunburns and increase the risk of skin cancer. Next up, we brings us yellow nail syndrome, a rare condition where nails turn yellow and grow slowly. It's often associated with respiratory problems and lymphedema. Finally, for Z, we have Zollinger-Ellison syndrome. This condition involves the overproduction of stomach acid, often leading to ulcers. It's typically caused by tumors in the pancreas or small intestine. And there you have it, folks. We've journeyed from A to Z through the world of unusual medical diseases. We've covered a lot of ground today. We plunged into the profound depths of the medical world, exploring 26 unusual diseases from A to Z. We traversed the alphabetical landscape, discovering conditions that may seem bizarre, but are nonetheless very real for those who live with them. We started our journey with diseases like Alice in Wonderland syndrome that muddles one's perception, to the rare blue skin disorder, which, as the name suggests, gives a bluish hue to the skin. We then delved into the peculiarities of conditions like the Cotard delusion, where individuals believe they're deceased, and the dancing plague, which led people to dance uncontrollably. We also examined the enigma of exploding head syndrome, a condition that causes sufferers to hear loud noises in their head. We then moved on to the lesser-known world of fibrodysplasia ossificans progressiva, a disease that turns soft tissues into bone. Our journey also took us to the realm of hyper-IgM syndrome, a rare genetic disorder that affects the immune system, and then to jumping Frenchman of Maine, a condition that causes an exaggerated startle reflex. Through this exploration, we've highlighted the importance of understanding and awareness. These diseases, while unusual, affect real people. Knowing about them not only broadens our knowledge but also fosters empathy towards those living with these conditions. Remember, just because a disease is unusual doesn't mean it's any less important. Stay curious and keep learning.